Unicorns gather! Hi guys, I'm Yuna. Welcome back to another episode of my Dear Diary Face Journey with Myasthenia Gravis. In this video, I'll be sharing to you guys my personal experiences with 5 different MG drugs and infusions. So it'll be my personal hot take. So just to clarify, it might not relate to everyone, but I'll be sharing you guys about how the drug works in your body with some drawings and graphics, and also like side effects and costs. A lot of people have asked me, reach out to me about how I felt about these drugs. So this video, I'll be clarifying all these great details and information to you guys. Before we start this video, please like, share, and subscribe. If you have any questions, please feel free to reach out to me by email, or also if you want to join my podcast, go to this link. Before I share to you guys about the drugs, I want to just demonstrate all you need to know about GMG and how it affects our body. You guys can see, you have, that's called this muscle. Almost forgot to spell muscle. Is that how you spell muscle? Okay, so this is your muscle. And we have this thing called, this is your nerve ending. By the way, guys, this is called your neuromuscular junction. So where the muscle and nerves communicate to each other. And we have these things called acetylcholine. I think that's how you pronounce it. Basically, these are signals that are being sent from your nerve endings to your muscles so they can contract and work together to help you move and do everything. Where these little signals are going through are these things called receptors. They're the one that are receiving the signals from your nerve endings. And normally, these signals would go to the receptors and the muscle would start contracting, right? So here muscle contracts. And then you can move, right? You know, all these active muscles are moving. It's because your brain sends a signal to your body and the muscle contract. But with GMG, myasthenia gravis, what happens is that our immune system produces this antibody, which looks like this. And it blocks the pathway to the receptor, as you can see right here. And not only does it block the signal to the receptor so the muscle cannot contract, it also sends a signal to your immune system and say, attack! Ah! And then what happens, these proteins are being made from your body called C5 protein. C5 protein. These proteins then will come to this place and attack, damage the receptor in the muscle. So what happens with GMG is not only that the signals couldn't be sent to the receptor, but it also damages your muscles. And that's when we have fatigueness that happen throughout your body. So a little bit of a medical nerd right here, but this would really help for you guys to understand how these different types of MG infusion works in your body. And just to give you guys all the information you need to know with this chart, you can send it to your family or your friends that don't know about MG and you don't know how to explain to them. This video would help. Basically, this is the neuromuscular junction, right? And then we have, where's my orange marker? Here, this thing is called nerve ending. And then we have this tiny thing called receptors. And then the blue one is called acetylcholine. I think that's how you spell it. Basically, nerve sends signal. Right? And yeah, so this is all you need to know about neuromuscular junction and how MG happens. Okay, now we're gonna be talking about the drugs I've been through and how it works in your body, the treatment dosage, side effects, my personal ratings, the financial side. I won't have my rating on Solaris because I haven't gone through this drug, but I've gone through the other 5. I want to start with IVIG because a lot of neurologists recommend IVIG in the beginning when of people's diagnosis. And it's relatively cheaper, I would say. It's more common treatment, alternative treatment for prednisone, because you definitely don't want to be on prednisone, especially on a high dose for a long period of time, because it messes up your bone density and does a matter of side effects on your body. So how IVIG works is that it basically flocks our body system with healthy antibodies from donors. And it's supposed to help suppress our overactive immune system. Suppress immune system. Okay. With this specific drug, because it does flood the system with such big amount of antibodies, there is more severe reactions that patients experience. My personal experience with IVIG is that I actually had a pretty severe headache, and I suspect it was a septic meningitis. So that is something to be looking out towards when you're considering IVIG, is that since it floods such a large amount of antibodies in your body, it could cause a lot of severe mild headaches or nausea. I've heard a lot of people complain about them having nausea, vomiting, and then headaches is the most. I was sent to the ER actually because my headache was more severe. So this is 20 to 30%. And I would say that people have severe reactions are less than, it says it's less than 1%, but I had very severe reaction. Septic meningitis. And the reason I believe why it happens, people having severe reactions, because you're flooding your body with foreign antibodies, and so obviously your body's going to have a reaction. So it's more common for people to have reaction for this kind of drug. And for the treatment dosage, okay, let me see. It is, in the beginning, we have it will be given to you 2 to 5 consecutive days. And then after that, it's, it says on average is every 3 to 4 weeks as needed. And I think there is a home, I had a nurse come to my home to give the infusion, so I would say home infusion is possible. My personal rating, okay, because I did have a severe reaction towards this drug, I would not give it a very high score. And I would say that, so my personal rating, I had severe reaction, and also I think that from my research, a lot of people didn't stay on IVIG, so I feel like this would have a less rating of how it helps MG. So I would say severe reaction and less beneficial. For people with more severe MG, this might not be as helpful. My personal rating out of 10, I give it a 2 because it was very horrible. If you listen to my previous podcasts, you've heard me talked about how I had severe reaction, basically on my bed, hyperventilating and screaming. Felt like my head was throbbing. Someone was like using a knife to stab stabbing pain of my head. It felt like my head was about to explode. It was very horrible. I would say it's on the convenience side. It's more convenient because, you know, it is, you can get it in at your home place, and it is more cheap for the other treatment options I'll be talking about. I would say it's convenient. Oh, no, I spelled it wrong. Convenient and cheaper for here. 10 to 30K per session. So let's say if you have it every 3 weeks, let's say it's like every month, 12 months, 12 times 10 is around this much money per year. And by the way, this is without insurance, so I would looking out to your insurance plan and also see if there's a copay program to help you with the treatment costs. But it is no kidding with how expensive these drugs are. Next one I want to talk about, if I want to go in order, I did Vyvgart after IVIG, but I feel like plasma exchange is something I want to talk about first because this is not MG specific drug, so I'll be talking about plasma exchange. It basically how it works is that it circulates your MuSK and antibodies, which is like the ones that causes muscle fatigueness, out of your system and replaces with purified plasma. Okay, I've done plasma exchange during a time where I've gone through other MG infusions and my symptoms were actually going worse. So this is what my doctor recommended after just trying every different kind of drug, but unfortunately it didn't work. And for plasma exchange, this won't benefit to people that have milder symptoms of MG. This plasma exchange would really help those that have severe symptoms of MG, such as like breathing problems and more severe muscle fatigue, like weaknesses in your body. So I would say there's not a lot of side effects. The most side effects I've heard about is numbness and a little tingling feeling. I definitely had a little tingling sensation. This is not to be scared of. It's not, I would say the side effects are not scary. It's just since the plasma exchange is like, the needles are like really long and like metal needle, 2 arms. You have to have one side taking out your blood and one side coming in with the purified plasma. So I would say it hurts. It for sure hurts. My arm was definitely bruised up after one session of plasma exchange. And for one session of plasma, it is 5 sessions over 1 to 2 weeks, usually every other day. But it is more intense drug because you don't have resting time for your arms, and it's definitely very, very scary. Honestly, it is life-saving for people that need a ventilator to breathe, so I would still give it maybe a 6.5, only if you really need it. And this is a more common drug, so it is around 20K to 40K per session. Okay, next I'll be talking about all you need to know of MG infusion drugs and how it works in your body. So I've separated into 2 categories with Vyvgart, Rystiggo on this side, Ultomiris and Soliris on this side. So the reason why I separated these into 2 categories is that it approaches the antibodies in different methods. So for Vyvgart and Rystiggo, I have here lysosome. What happens is that your body actively produces antibodies every day. And also it removes some antibodies to waste. Your body produces, let's say these are the harmful antibodies in your body, and these are some healthy antibodies that helps with infections. Every day your body would bring some into waste. Let's say the majority is harmful antibodies right now. It would, every day it would bring some to waste, but our receptors, the FcRn receptors, would keep some antibodies because your body still needs some antibody in order to fight off infection, so it will keep some. And for MG patients, a lot of the harmful antibodies are being kept in your body, so these are going to continue to affect your muscles, causing weakness throughout your body. And for Vyvgart and Rystiggo, how it works is that Vyvgart looks like this. Rystiggo looks like this. And these are being injected to your bloodstream and going in your body. So basically what happens is that we have all these harmful antibodies that are still being kept in our body, right? But we want to remove them gradually. So how we do that is that the antibodies cannot be destroyed, right? And so what Vyvgart and Rystiggo does is that it floods the system with these 2 different types of antibodies. And these antibodies are very, very, very strong. And so it strongly binds to these receptors, right? And so during cell waste, these good antibodies are being kept instead of the harmful antibodies. So let's draw this. Vyvgart and Rystiggo are the good ones. So these are the good ones. These are the bad ones. These are being swept away by the body system because now we have Vyvgart and Rystiggo. We have Vyvgart, Rystiggo in a body. So gradually, the Vyvgart and Rystiggo would have in numbers win over the harmful ones, because the harmful antibodies, if you guys remember, it looks like this. It's gonna go into cell waste. Bye bye. It's gonna go bye bye. And now we will have, as these antibodies are being getting out of your system, your muscle is gonna start contracting again, right? Yay! So that's how Vyvgart and Resigo works. But then again, as the medication starts to wear off and your body starts to produce harmful antibodies again, right? See, now we have more antibodies, harmful ones, now by number and 1 over the healthy ones. Your body's gonna start to have flare-ups, and that's when you experience weakness again. So then that's when you'll probably have another dosage of the Vyvgart Resigo in order by numbers. 1, when bind to the receptor and help these harmful antibodies be swept away out of your system, and so only the healthy ones are being kept in your body. But for Vyvgart Resigo, it helps for getting your symptoms to stabilize and for the antibodies to be swept away. But again, it is something that you'll need as you experience the symptoms again. Some people need more infusions because their flare-up happens faster, but we always want to keep that remission phase a little longer, right? So then we don't need to rely on these medications. Next category I want to talk about is Soliris and Ultomiris. These two medications uses a different approach from Vyvgart and Resigo, in that, as you guys remember, I talked about how the antibody is attacking and damaging our muscles, right? It calls the C5 protein in, and the C5 protein would start harming. So basically, the C5 protein will start damage this muscle. And that's bad, right? So what Soliris and Ultomiris does, it looks like this, right? Ultomiris and Soliris are being injected to your body, and they bind to this C5 protein. So then the damage won't be done. And that's how Soliris and Ultomiris works. It's binding to the C5 protein so that it doesn't causes damage to your muscles. And that's a little different approach to Vyvgart and Resigo. I would say for Ultomiris and Soliris, because it does bind to the C5 protein that is usually attacking, diseases and infections, there is a risk to meningitis. So that is one thing Ultomiris and Soliris have in common, is that you have an increased risk to meningitis infections. And so you're required to get boosters of meningitis before you start these treatments. And I'm currently on Ultomiris, so I have received the meningitis shots before I've gone through the treatments. I've written down how it works for Vyvgart Resigo. It's FcRn blocker and helps accelerate the clearance of harmful antibodies. For Ultomiris and Soliris, it helps block the C5 protein from damaging. For the treatment, Vyvgart and Resigo is a little different, just a little different. The Resigo, one session is takes less time than Vyvgart. Vyvgart, I think, is 2 hours. Resigo is about 30 minutes, I would say, 30 or 45 minutes. But Resigo, you have a longer cycle. So Vyvgart is 4-week cycle, once per week. Resigo is 6-week cycle, once per week. And then as your symptoms come back, you order in another dosage for Vyvgart and you start the cycle again. For Ultomiris and Soliris, you'll go through, obviously you need to do your meningitis shots, and then your doctor, based on your weight, you'll have your medicine mix and you'll start a loading phase. For me, it was every other week for 5 times, and then it's every 2 months. So I like that how Ultomiris, it's a longer time, and it's less like Vyvgart and Resigo that you need to experience the weakness and then order in the drug, because I feel like when you actually experience the weakness coming in, it's harder to get the immune system down, calm down, than have a more stabilized treatment like every 2 months. I feel like the consistency is, if you're like me, like I like consistency in my treatment, and I don't like my symptoms like kind of up and down. I think Ultomiris and Soliris is really good. For Ultomiris, it's every 2 months after loading phase. Soliris is once per week, and after the loading phase is every 2 weeks. For my side effects, Vyvgart, mild headaches, 32%, respiratory infections, 33%, urinary tract infections, 10%, headache, 44% for Restigo, infection, 23%, diarrhea, 20%. And then for Ultomiris Soliris, I talked about meningitis caution. I would say just do your boosters, and I would say all of these drugs that I mentioned so far are immunosuppressant drugs, so your infection rates are going to go up. So that's something to be lookout for. And obviously we have, again, headaches. I don't know why headaches is a really common thing for a lot of MG treatments, but I guess it makes sense since it's like a neuro disease. So I don't know. Okay, for Ultomiris, we have 10% headache, so it's less than, it's like the least amount of percentage from Vyvgart Restigo. And then we have respiratory infection, also 10%. Soliris, we have 44% headache, 23% cold, and 19% back pain. I have not tried Soliris, so I could not say my rating on it. I would only say it is more consistent, I would say, in treatment wise. You don't have to wait till like the symptoms come back. Consistency. But then it is a really expensive drug. I would suggest to look into Alexion One Source copay program. They help bring down these copay even to like $0. So I would really suggest looking into copay programs. And that's the same with Ultomiris. One Source really helps. And then for Ultomiris, I would say I like the consistency, but again, it is such an expensive drug, so insurance approval is pretty hard. I would say this drug you'll only possibly get approved by your insurance if you are on the more severe side of MG, like you score higher on your GMG, what is it called, symptoms chart. So that's something to be looked out for. I like the consistency. I like how it's insurance approved. Also, I have less side effect. This is me personally, because I've experienced almost all of the drugs I've done, Restigo, IVIG, they cause us intense headaches and just side effects. So, and I have to stop Restigo and IVIG, unfortunately. So that's just something that I would give it a 9 right now, because from my experience, I've done Ultomiris for about a year now, and I'm pretty much really stable with my symptoms, as you guys can see. So, and I definitely went down my prednisone levels. I was taking like 20 milligrams every day, and now I'm like pretty much free from it. For Restigo, again, I had severe reactions, severe headache. It was really bad, really bad. Similar to how I experienced IVIG, was pretty bad. It's a 3. It's a 3. It's a 3. And then for Vyvgart, I would say, actually this one is pretty high. I would say a 7. Oh, but for Vyvgart, hard to manage. And then also like flare-ups. That's the same thing for Restigo, because for these drugs, you're kind of dependent on these drugs, because when you get flare-ups, you need to order another one again. And for me, Vyvgart, when I tried the first cycle, it worked really well. I had remission for almost 5 months, but then I had a flare-up, and I did like 3 cycles of Vyvgart, and it just didn't really work. So I would say that for Vyvgart, it's harder to manage. It's harder to have full remission, I feel like. That's my personal experience. Lastly, I just want to say thank you to everyone that's supporting me through my medical and faith advocacy journey. All of you guys' story matter to me so much, and I really hope you guys can keep going. I know it's really hard, but God is with you, and God bless you. God bless everyone that's watching this right now. Know that you're not alone, and if you have anything you would like to pray, if you have any prayer requests, please let me know, and I'll see you in my next video. Please stream my song. I forgot to mention, but I just dropped my Chinese podcast of my medical and faith journey with my St. Gravis. So every week right now, I'll be sharing one episode of the Chinese version for my Mandarin speaking audiences and English version of my medical and faith podcast. So look out into those videos coming up. Unicorn.